Good afternoon, everybody. This is Elizabeth Viola, the Chief Program Officer at the Early Learning Coalition in Marion County. We are so glad that you're with us today, and we look forward to sharing some pretty exciting news with you. In the fashion that we have had these calls over the past few weeks, we're going to just get right into our agenda, which was emailed out to everybody around 12:15-ish. Probably today, and then it is up on your screen that you can pull it down. We're going to share the news that we have, and then we will open up the floor for questions that we can answer. And this afternoon, our daily email will be a recap of this meeting, as well as the answers to the questions that you asked, just like we did last week. So that being said, welcome, welcome. And the first thing is something really exciting. Oh, yeah. Can somebody tell me if you can hear us? Got it. I think Marcy worked really hard at making sure we didn't have any audio issues today. So thank you. Yay. All right. Thank you, everybody. So many of you have already assisted us in getting the word out about this first responder and essential medical personnel assistance that we are able to support right now. You may have gotten an email. We're hearing all sorts of stuff. We're getting parents that have seen it on Facebook. We're having you all contacting your parents, which is beautiful. Saying call the coalition, they have this program, and you're absolutely right. We have received and been working really hard. Roseanne's been working with our county commissioners and Tallahassee to get some supports put in place for first responders and essential medical personnel to assist in paying for their child care services so that they can continue to battle this COVID pandemic that we're all facing and to try to help us control what's going on. So that being said, we have a referral process that is going to go directly to the employers of our first responders and essential medical personnel to refer the staff members who need child care services over to the coalition so that we can then pay them for the child care services you are providing. Now, your question is going to be, who qualifies as a first responder and an essential medical personnel staff member? So really and truly, it is your common sense, okay? So when we're thinking about our first responders, it's your people that are responding to emergency services. It's your police officers. It's your ambulance drivers, your paramedics, your who else, everybody? Firefighters. Listen, we got a whole group in here. That's too long for me to read that. So I just got thrown definitions, everybody, that we will include in our this afternoon in our email. But it basically talks about, we do have some definitions. Healthcare workers. When you think of anybody that's providing medical services right now, or is home health aide, a CNA, I talked to an ER nurse today. We are getting calls from all sorts. I talked to somebody that was working at a pulmonary office, at a pediatric office, police officers, Ocala Medical. All of those places, those are all our first responders and our essential medical personnel. So we are working directly with them, and we will be providing the referral form to those entities that have employees that fall under this category. The HR department there at all of those employers are then going to send the referral back to the coalition, and we will process it just like we do for our BG1 parents. Okay, so you all are typically familiar with how we process our BG1 clients, and so we're acting fast in that same manner, just like we normally do. I'm proud of you. I'm not seeing a whole lot of questions popping up yet, so you guys are doing really good. Tomorrow, you're going to get a call. We've switched up our calls so that we're not bugging you every day to see how you're doing, even though we care about you. So even on a Tuesday and a Thursday, if we don't call you, you can still call us. Our quality team, though, when they reach out and do their well calls to you, they're going to switch up what they ask you a little bit, because we are trying to make sure that all the parents that qualify for this service understand that it is an option for them. So the first responder parents and the essential medical personnel that you are currently serving their families at your site, our quality team is going to ask you to fill out a very short little form that asks you for the parent's name, the parent's phone number, and the employer that they work for. And that way we can make sure that that employer has this referral form so that we can cover all of their expenses for childcare. Now, that is only for your school readiness enrollment, because you don't want to, we can't ask you to break any HIPAA laws or tell us about your private pay. But what you can do for your private pay families is tell them to give us a call. The contacts here at the Coalition are myself, Elizabeth Viola, and Latricia Sims. So we're literally carrying around our office phones with us and a notepad and all sorts of other information to make sure we can connect these parents with the pieces of information that they need. Now I see Marcy's already able to kind of handle some of the questions that are coming in. So let me pause for a second and see if we can do some answering your question.
I assume the first responder service is only for SR providers.
Yes, you are correct. If you are not currently contracted for SR with us, for school readiness, if you're a VPK only provider, we are very interested in you becoming contracted with us, even if it's just temporary through June 30th, to allow you to serve these families and be paid for it. So the other piece of that is something to think about for those of you that are VPK only, is we do have the ability, now you do have to still meet the contract requirements. However, some of you didn't like that you had to do ASQs now, just an example. That is waived until June 30th for this year. So if you're considering coming back with us as a school readiness provider, or if you've never done it before, please reach out to your contact for that is going to be Scott Stevenson. And if you reach out to me, I'll forward it to Scott, but Scott is the main contact to get you contracted. And he's going to roll that out. He's got a great contact at DCF that's expediting the things that we need to put in place in order to get you contracted pretty quickly so that we can do this. The other thing that is waived right now for school readiness contracts is the class score. So that is waived until June 30th. And this is, again, these are all things that have been placed down from Tallahassee to allow us to move smoothly through school readiness contracting and serving families that need this help right now.
Okay, so the next question is this for Marion County parents only?
Each county is going to roll this out in a different way, but for us, yes, we only serve Marion County residents.
Will they still be responsible for their differential?
Yes, at this point, if you have a differential, then yes. If you can waive the differential because you're getting some other incentives that might support these families, then that would be amazing, and the families would be really grateful. But yes, you can still charge a differential. And if you have a registration fee, you still can charge a registration fee as well. Your typical fees that you have uploaded as your public rates, the things that your private pay rate sheet that's in your profile, those all apply, and you should follow your parent handbook. So all of your policies and procedures, this doesn't waive any of that. What this does is it provides an alternate source of revenue for these families that may not typically qualify for school readiness services. It allows them some part-time assistance.
Okay, so the next question is, What about TS Gold?
TS Gold is, if we literally have 3 providers that are offering TS Gold this year, and right now there is no expectation of you to continue doing that on, even though I will tell you, if you want to keep going, rock on. Let's do it.
Okay, so the next question is, if we are still charging registration fee, but the parent can't afford it, then what?
That is up to you. So I would say take that on a case-by-case basis. Maybe look at a different way to work with the parent. Maybe break it up over a couple of weeks. Maybe you look at scholarshiping, or there's just different things that you can do. That's completely up to you, though.
Okay, next question. I have a parent with 3 children enrolled. Is there a limit on the amount of children that can be covered?
Nope, there is no limit on the amount of children that can be covered. The only limit would be you sticking to those CDC guidelines that are required now. So that would be the limit, is that you stick to the guidelines. Yesterday, I sent out a fact sheet on the governor issued, somebody help me with the word. Thank you. Executive order that kind of defined some of those pieces in there that were a little bit cloudy or harder to understand. And this afternoon, we can actually include some more clear guidance on the CDC childcare regulations. I did send a link yesterday to that too, but that would be the only limit.
My parent lives in Marion County but works in Gainesville. Would she get help from Gainesville or here?
She would get help based on where she lives. So if she lives in Marion County, then Marion County is responsible financially for her. She can travel to Gainesville to work, and if her kids are enrolled with you and you are our provider and she lives here, then we would be paying for that service.
Do we have the right to turn them away or make a payment plan?
So that falls under your private business policies. I'm not sure what you would be turning them away for, but if they can't pay their registration fee, then definitely I would encourage you to do everything within your power to enroll these children and serve these families. Again, this particular piece is a short-term. This part is short-term based on through June 30th at this time. So I would encourage you to do whatever you need to do.
What if they haven't updated your what if they haven't updated your contract on OEL?
Okay, so I'm not sure what that means. If you mean like a contract amendment, I would need a little more information about that. If you have, I'm not sure what that means. I need more info, please, whoever's asking that.
How does dropping TS Gold change the payment for it?
So right now, your TS Gold differential has not been paid out yet. So if you are one of our 3 providers that are participating voluntarily in TS Gold, you can continue to enter your last checkpoint. I believe you're in your last checkpoint right now, but I can have Scott reach out to you and get some more information. So we'll just have the quality team work with the 3 of you that are offering TS Gold to find out where you're at with that, and we'll work with you individually. Thank you. And Scott gave me a thumbs up, so he's on it.
Are we still allowed to take them? I'm assuming them is the children outside.
Yes, you can take your children outside. Please maintain the same groups as much as possible, so you're not switching children up. And it is recommended that you clean the equipment between groups of children. So if they're going outside, let's say they're playing with hula hoops, bouncy balls, and they're going down the slide, you're definitely going to want to take precautions and clean that equipment between the groups that go out there.
Are masks required for now?
Masks are not required yet. The CDC has changed their recommendation, though, to say that a cloth mask is recommended just to cut down on the amount of exchange of breath, I guess, air between humans. It reduces your exposure. And yesterday, I actually did send out a pattern that one of our providers has been using to sew their own cloth masks. And there are all sorts of different opportunities. I also included in yesterday's daily update a video on YouTube of how to make your own mask. And I also included a no-sew option for people like me who have no idea how to run a sewing machine. I guess I better learn, but that is an option for you too. So it's not required. It's recommended at this point.
Okay. Are we only allowed to be open for essential workers only?
So I would have to, and I don't know if we have anybody from DCF on the line right now. I would say, allowed is a very fluid word. I'm not going to tell you, the coalition is not going to tell you that you can only serve a specific population, because that's not what we do. But I would say that is definitely a question for DCF, for your or your regulatory body. So if you are license exempt and you don't go through DCF, but you have an accrediting agent, I would definitely recommend reaching out to them and getting their opinion on it.
Okay, Avita is actually on the line, so bear with me. I am going to unmute you. Avita, are you there?
Yes, I am. How are you? Good morning. Oh, good afternoon.
Hi, thank you for joining us.
Yes, you're welcome.
Do you have any insight on that question?
Yes, I do. And it is a business decision if the facility wants to remain open, and what services are they going to be serving the community. So if they are just want to be open for essential workers, first responders, healthcare providers, they may do so. If they choose to provide care for all children, then they may do so too. They have to follow, however, the CDC guidance, no matter what room capacity they have. So let's say if the room capacity is 20, they must follow the CDC with a group of 10, including their staff. But we are not requesting them for them to close. Like I said before, it is a business decision for them to make.
Okay, that's awesome. Thank you. While we have you on the line, Avita, can I ask you a question about changing of hours, business hours? If a provider wants to reduce or extend their hours, what process would they go through to do that? And does that have to change their license, or can it be done temporarily?
If it's temporarily, that's fine. They'll just have to notify us and put a sign on their window, or anywhere where it is available for parents and clients to come in, that they're changing operations changing hours temporarily, and just indicate that. Okay. And let us know, because we still doing inspection to facilities. We're still doing our routine inspections. We do our re-inspections over the phone, but my counselors are minimizing the time that they're spent at the facility. So the facilities will be seeing our counselors there, but at a lesser time frame. But if there's any changes like that in hours, just, let us know that these are your temporary hours. We don't have to update that on CARES or give them a new license, because it's a temporarily, just as long as we know, and as long as they just put it in a conspicuous place. If they are going to change the hours permanently, then yes, they need to let us know so that we could give them a new license with the new hours.
Okay. That's wonderful. Does that go the same if they reduce their hours or if they expand their hours?
Yes. Or
Okay.
their weekdays. So if they want to operate, 3 days a week or 2 days a week or 2 weeks, or if they want to extend it to Saturday and Sunday, they need to let us know.
Okay. Thank you. I appreciate that.
You're welcome.
Okay, I'm going to put you back on mute there, Avita. The next question is going to be, TS Gold for the third checkpoint was due April 1st, and I know they said we did have extra time to complete it. You stated we don't have to do this checkpoint 3. So are we automatically going to get paid the extra percentage for those children, or is it only if the third checkpoint is done?
So I'm looking across the table at Deanna, our Chief Finance Officer, and she's nodding yes, you will end up getting paid for those children. I would say if you have the ability to input any of that data in, even though the checkpoint is passed, it can't hurt anything. So I would definitely recommend that, although it wasn't required for you to meet that deadline, you're not going to be penalized for not meeting the April 1st deadline, which is last Wednesday. We definitely understand the situation that's going on. So we will move forward with that as we're able to give that differential out to you. So it won't hinder it. If you can get them in there, please do.
Okay. The next question is, are you only paying for first responders?
No, we're also paying for essential medical personnel. So there's a very broad array of employees that fall under both of those categories. So right now this particular referral is for first responders or essential medical personnel. And I'll go ahead and say this because I think this question is going to pop up. Some people have already asked, well, what about essential workers that are still working in grocery stores and laundromats and car dealerships and things that are remaining open because they're essential services? We would encourage them, if they're not already in care. A lot of those families are already being served through school readiness, and we're going through our wait list to see who's on there that is employed in one of those services. But I would tell you, go ahead and have those parents that you're running into apply for our wait list so that we can look into that further. Because we are, just like you all, we have to take things week by week, in some instances day by day, minute by minute. So we encourage those parents to still apply so that we can see how we can help them.
Okay, there's no more questions.
No more questions for that. So we're going to move forward on our agenda. Look for a summary of the things that we talked about and the answers to the questions that you asked later on this afternoon with our daily update. You can continue to tell the parents to reach out to myself or Latricia if they're interested in this particular referral for first responders or essential medical personnel. The next thing on our agenda is I just want to remind providers. Okay, hold on. Let me stop and answer this question that popped up before we move on.
What are the attendance requirements for the SR first responders?
You would complete your attendance as you typically do. So the enrollments will be done the same way you're used to them being done through the portal. And you'll have to go in and accept the enrollment so that the child is added to your attendance roster. And then at the end of the month, or actually, we recommend daily, but as you see the children and enroll them, they're attending daily, you mark your attendance just so.
A follow-up with that one is, what if they don't attend daily every day?
Well, you would complete your attendance as they attend, or if you do your attendance weekly based on your sign-in and out sheets, because that's the other thing too. You still need to keep sign-in and out sheets just like you would for any other child. So you would complete your attendance through the portal based on your sign in and out sheet attendance and however else you track your attendance.
And don't forget right now, for the children that aren't coming there, your standard for this month and next month is to choose absence due to disaster for the days the children are not there.
Yep. For the month of April, yes. And we will continue to support you through that. And as we get closer to you having to submit your attendance, we'll do what we did last time with the reminder about attendance submission. And that's actually on the agenda here at the end.
Next is I still get ASQ requests, but we are closed. Should I just respond to those when we open back up?
I'm not sure what that means, that you're still getting, it might be a request of a child that wasn't screened prior to this all happening is the only thing I can think of, or a reminder based on the child's birthday. So we can look further into that. Scott is going to have VidMary look at that and see.
Okay, what is they are paying to hold their spot but not coming? Okay, what are if they're paying to hold their spot but not coming?
Okay, so we had a discussion with our quality team about this earlier today. We are getting, as we're making our well calls to you all, that was a big question that was coming out to our staff is, well, you know, if we enroll these first responder families and essential medical personnel, but we don't have room for our already enrolled families to come back, what do we do then? So my general answer to you is going to be, take it week by week. We don't know what the landscape is going to be a month from now. We don't know what that means for the families that are holding their spot. Now, if they're paying you to hold their spot, I definitely think that warrants some communication with the family about where are they at today. They may have a different job. They may not have a job right now. They may not know what that means as far as coming back. So I would definitely encourage you, reach out to your families that have been enrolled with you and see what that means. Talk to the new people that are coming in. Your best friend right now is communication. So have that orientation with that family, even if it's a phone orientation where you're asking questions. How long are you looking for care for? You know, what hours are you looking for service? Those are the types of things. And we are encouraging and we're asking, as families call us, we're asking them, do you already have a provider? I can already tell you the first 6 that I talked to right before I came into this call, all were already enrolled with you all. So they're already sitting in the classrooms there. So, and Roseanne's very happy to hear that. So, you know, have a conversation. Just talk and find out what their needs are going to be and reassess it and let them know. Just like you, we're not sure where this is going to go, and we'll deal with it as it comes along. And we're going to have to be very patient and very open to change as needs occur and arise.
A follow-up to that question is going to be, what if it's a first responder that's paying to hold their spot but not coming?
Again,
spot but not coming, can they get SR?
So, I mean, if they're not attending, then do they, again, I would go back to that conversation with them. Do they really need that spot, or are they doing it just in case? If the answer is just in case, then you should really have that conversation with them about whether or not it's worth it for them to hold the spot, because the funding should not be used to hold an empty seat open, if that makes sense.
Okay, the next question is going to be, if our tentative reopen date was April 15th, which we based on community response to COVID-19, now that dates have changed, if we would like to change our reopen date timeframe due to Marion County cases continuing to increase, what are our options as SR VPK providers for the month of April?
So if you're going to change, that's a business decision. So if you're going to decide to close, which I'm very happy to report today was the first day since this all started that we did not have an additional closure of a site. So I was excited to share with Tallahassee that our providers are maintaining, the ones that are staying open are maintaining that. If you choose to close, I just need you to send me your site name, the date you are closing, and your anticipated reopen date. Then I also need a reason why you're staying closed. I have to report that, the coalition has to report that on a daily basis to Tallahassee. So that is a business decision. How that impacts you for the month of April, we shall see. As far as getting paid for being closed, which is, I think, part of that question, I don't know that we have a clear directive on that quite yet. But right now, we know you're getting paid for the month of March for being closed. Do we have a clear directive for April? So then if you close for the month of April, you'll get paid for the enrollments that you have up until the date they transfer, just like they did for March. So it would be a repeat of March. All right.
Okay, go on with your agenda.
Okay, so number 2 on our agenda was just to remind you about the stipends that the coalition issued. Our exec committee decided to reroute $100,000 of quality money over to assist providers who were remaining open, and thus decided to pay you $50 per day for the 5-day work week. So $50 per day for providers that remained open for the 5-day work week. So some of you received money in your accounts, and this is only for school readiness providers because quality dollars are only for school readiness providers at this point. For those providers that stayed open, some of you received a deposit on Monday and were very grateful yet curious as to what that was about. So while we fielded a bunch of different emails on that, we thought it would be important to let you know that that did happen. The first payment did happen, and the next payment is scheduled to go out, Deanna,
March 20th?
the next 21st stipend payment.
For April, honey?
Oh, shoot, April, yes.
I can't remember March.
Is it on the same day as their regular payment?
No, it's going to go out with a separate payment. It's supposed to go out the 22nd or 23rd. I think it's the Thursday after the 17th. Whatever that date, I can't figure out.
Okay. So the second payment, and basically if you're remaining open, you will continue to see a stipend up until we exhaust that $100,000. We just wanted to remind you about that. I'm looking to see if there's any questions that popped up about that. I don't see any.
Nope.
Okay. The last thing on the agenda is your attendance submission and closure dates. We just talked about that. Basically, if you choose to close or if you are closed and you're extending your date, you're going to want to send me a new email, please, that extends that closure date. And that's very important for a couple of reasons. One, because we have to report it. 2, for data accuracy of your attendance. Because our team at the back end, just like we did for March, have to go in and put those emergency closures in. And I know a lot of you were waiting for our staff to call you. We're not calling, though. Our mod squad, Justin, who's in charge of our emergency closure piece, is emailing you saying that's in. And basically, if you chose to close, then basically, if you chose to close, then you will see an asterisk in place of where your children's attendance would be on the days that you were closed. So for a child, let's just say in March, if you closed on March 30th, on March 30th, if you closed your doors, then an asterisk should have popped up that would have already assigned that closure to that child. I hope I'm explaining that clearly, but I think you all figured it out. So for the month of April, it's going to be the same thing right now. I'm going to leave it at that. Let's see if we have any questions. Looks like one question. So this question is wanting to know how many providers have closed and how many have opened. As of today, we have 47 providers closed. And those are 40, so let me rephrase that. Those are 47 providers contracted with the coalition for either VPK or school readiness. That is not fully inclusive of all the legal operating providers in Marion County.
Oh, COVID-19 email has attached sheet says payment for March 16th through March 31st will be received by the provider on April 3rd. Mm-hmm. Payment for April 1st through April 17th will be received by the provider on April 24th.
I did put that out in one of the updates, so thank you for reminding us. I forget, we forget. We've put so many in there, but thank you for giving us that information. There's so much that goes out on a daily basis.
I guess this next question is going to be for myself and Deanna. Is the money that was owed for 2018, is that put on hold till after the virus? No. Nothing is being put on hold at this moment. We are still working through these processes. We have to get all of our manual adjustments put into EFS mod now. So we are still full force working on 18-19 to complete it out. That was the last question.
Okay, so that is the end of our agenda for today. So just to recap, we are going to start with the referrals for first responders and essential medical personnel. We're going to contact employers that have these staff under them that need your help. We are encouraging you to take new enrollments. I'm also going to encourage you to look at your operational hours. We have some of you that are deciding to close a little early so you can deep clean. Certainly, definitely understandable. But we do have and will potentially have a need for a lot of providers after hours, in the evenings, potentially weekends, so that these first responder medical professionals can serve our community in the capacity that they need to. Then the stipend is that $50 a day. We are still carrying that out right now for those of you that remain open. Something that's not on the agenda that I can tell you is that Tallahassee is also working on some things to support you that will be coming probably later this week or early next week on our next provider call, which is scheduled for Tuesday, April 14th at 1 p.m. Again, in the same format, we'll have our team in here and we'll bounce around things around the table, give you all the information that we have. If you're going to close, let me know in writing with very specific dates and a reason and who you are. And also one last announcement, if you are closed or you're not employing all of your teachers right now because your enrollment is low, we have a need in the sites that are open for qualified staff on a temporary basis to help serve some of these families that are coming in. So if you have information for teachers or you have teachers that would like to continue to work but you're unable to provide them the opportunity to do so, if you could just have them reach out to any of our staff really, or you just respond to my daily emails and we'll hook them up with a provider who needs additional staff. So that being said, we're going to answer a couple more questions.
Will we still have to submit our sign-in and out sheet for April if we choose to remain closed?
If you are closed, you won't have any sign-in and out sheets for the month of April, unless you are open for only a period of time. So if you're, for whatever time frame that you are open for, then yes, you would have to submit those, and you would also have to fill out your attendance for that time frame that you were open.
Can these meetings go towards our hours needed for relicensing?
That would be an Avita question. I'm not sure if she would allow us to issue a, if her team would be okay with us issuing a certificate for the hour that these calls are. I mean,
And Avita, I've
Yes.
unmuted you if you would
What
like
is the
to
question
answer that.
again?
so the
What was-
question is, can these webinars for the providers, can they count towards training hours for their DCF renewals for those that were on the call?
For the 10-hour in-service training, you mean?
Yeah.
I believe so, as long as they're accounted for and somebody's signing off on it. I can ask my program manager, but I don't think that's an issue. I think that we could use those hours for sure.
Okay, and we do have a way of seeing who is on the call, so we can issue a certificate to those that were on the call.
Okay,
If
that's
you all
awesome.
will. Thank you, Avita.
Okay, and a bunch of thank yous for all that we're doing and that you appreciate us.
And we appreciate you more than we can say. Another thing that I'm going to close this call with is tomorrow Quality is going to ask you if you have a need for toilet paper or cleaning materials. The coalition has been on a hunt to gather and order as many of those materials to help supplement what you're using for those of you that are remaining open. So we will be gathering information on your need and setting up a way for us to either do a drive-by pickup where you can just come to the front of the office. It will be a no contact exchange of goods where we will either put them in the back of your vehicle or we will put them up front for you to come and grab them, or potentially our staff can leave them on your front door. Well, yeah, we'll throw them from 6 feet away and you can just, we'll play toilet paper catch. But we do have some materials and we have been looking for you. One of the things too I want to throw out there that we have heard is about milk. It does the body good and we know you're having a hard time getting it. So one of the things that one of our providers gave us the hint on yesterday was if you're not one of those places that gets a delivery of milk on a weekly basis or whatnot, they're ending up sending staff out multiple times a day to grab milk. So while it's inconvenient, milk is available. You may have to try to just change up your daily routine. You may have to wear your mask, wear your gloves, run out to whatever store, make a run of 3 or 4 different stores to grab a couple gallons here and there just to build up your stock. That's what one of our providers is doing.
So there's a question, if teachers are currently being paid by their program, are they still allowed to work at the centers? If so, will they still be paid by the center they are working for?
So that's going to be your decision as an employer. If you are aware, if you are providing compensation, it's almost like somebody having 2 jobs. One job isn't going to, they're going to get paid for the hours they do at one job. The other job is going to pay them for the hours they do at the other job. So if you are compensating your staff for being off work, you know, it's really your decision. If you know that they're working for another company, then that's going to be a business decision on your behalf.
Okay, provider is stating if you have a contract with CBI Cheney Brothers, they have milk there, that's where she's getting hers. Another provider is passing on for milk. Speak to your store manager and let them know what you are doing. Most will allow you to get the amount of milk you need without going into the store multiple times.
Look at that. So communication is a beautiful thing. So you hunt down that store manager, stay 6 feet away. Or one of my friends that works for the Department of Health said they're now using the alligators distance away, which is a really cute way of really saying, you know, put an alligator's distance between you and me. But ask that manager if you can get more than 1 gallon of milk at a time or 2.
Okay. So this next question, can the provider send someone to pick up the meals from the school district? Children are not required to be present, and I know individual milk is being provided for both lunch and breakfast.
So that is not something that we have been involved in. So that would be a question for the school district. I would definitely recommend whoever your contact is for that, give them a call. And if you want to send me information, I'd be happy to put what you learn in our daily blast. But, you know, we're using resources from all over the place, and I'd be very happy to hear what you learn on that.
Yeah. Okay, a few more. Board and Milk also delivers if you sign a contract. Provider wants to know if we have a schedule for pickup of materials.
We do not. Tomorrow, your well call with your quality team, whoever calls you, Sienna, VidMary, Mary Brewster still making phone calls or no?
Yes.
Yeah. Mary Brewster, Lily, or Tiffany. If one of those staff members calls you, let them know what your need is, and then that's how we're going to divvy up what we have.
And Florida Foods has milk for delivery as well.
Florida Foods, that's a new one that I haven't heard yet. A lot of those other resources, if you go back and look in the updates that we've given, those resource links are right there that can allow you to have quick access to reach out and get a contract. Or I have heard that they're a little bit slow right now of getting back to you because their staff is also, they're working on a skeleton crew. But Florida Foods is a new one for me, I think. Maybe not. I don't know. I've learned a lot about a lot of places recently. This is great, though. Thank you for sharing your resources. All right. With that being said, we're going to say thank you very much. Please continue to stay safe. If you have a great idea, don't be shy. And share this information about first responder and essential medical personnel childcare availability everywhere, anywhere. We need to help these people so that we can get a handle on this and get back to life. Have a great day, and we'll talk to you soon.